Back then you had to be affiliated with one of the hospitals. I happened to be affiliated with the Edmonton General Hospital, the Grey Nuns, and then so you went and took your training over in NAIT with truly state-of-the-art equipment at the time. And in '89 we carried out Canada's first islet transplant, a group of, it's not just one individual, myself and a group of people, that Garth Warnock, Norm Kniedeman and Eddie Ryan. The future looks very bright for research across Canada, and I'm particularly pleased for my younger colleagues because I think it's been a little bit difficult to keep these young people in Canada.
I think it's testimony to the fact that we have world-class researchers in Alberta, particularly University of Alberta. As you know, Dr. Ray Rajotte and his team created what's known internationally as the Edmonton Protocol.
So then we have an organ donor, the pancreas, that in fact what we've been able to do is we get rid of 95% of the pancreas, the acinar cells, and we isolate just these insulin-producing cells known as the islets of Langerhans. And you just inject them up into the liver. They become, if you will, stuck in the small blood vessels. After a few days, the blood vessels become reconnected by themselves, and there sense changes in glucose. So if the blood sugar goes too high, the insulin-producing cells sense that and secrete insulin and bring your sugar back down. But equally important, if your blood sugar goes too low, the islets sense that and secrete glucagon and bring your sugar back up. In 2000, we went from a 10% success rate to 100% of the patients were able to stop their insulin therapy with the islet transplant program.
From that point onward, for 4 years, I was totally free of the need for injections of insulin. Now, for someone who has been dependent on insulin most of their entire life, that is nothing short of a miracle.
The limiting step in the procedure is the availability of organ donors. And about 10 years ago, we developed a method from a young pig that we can isolate these insulin-producing cells. The success that we've been able to achieve in the islet program, I really have to attribute it to not only my training in NAIT, but also the people. All my technical support have actually come from NAIT.
Where we end up in finding a way through the diabetes maze, I guess only time will tell. But I'm absolutely convinced that the work that Ray has done will be an essential part of getting to that final result.